So welcome to this video. In this video, I'm going to take you through a daily routine in the newborn unit. So first of all, before you get into the newborn unit, you need to do hand hygiene. And this happens to be the point, our first point in which we do our hand hygiene. So in this area, we do hand washing, and then you can now, once you're done with your hand washing, you can now get to the newborn unit. And the second step is you have to have an apron that is specifically designated for the newborn unit, and we usually have it placed here, and you take your apron and you have it on. So once you are done with the apron, now you have to go and see your patients. This is the main area where we have the admission done. And as you're coming to see your patient, this is where you are doing a confirmation on what you were told in the verbal report and now how it is translating to the actual patient that you are being handed over in the ward. Now you need to have the initial assessment whereby you do the vital signs and you do the general assessment of your patient to see how generally the patient is doing as you are being handed over, so that you know if there is an escalation that is needed, it is handled. If the vitals, there is a fluctuation, they are handled at that point. And once you're done with the initial assessment and you are comfortable that your patient can continue with the care that is at hand, then you now need to prepare for your day. We now come back to where we need to confirm if we have the required supplies. And this is the station whereby we need to have the supplies in place. So in this cabinet, you need to check on the emergency drugs, the fluids that you may need during your shift if they are available, the equipment that you use to do the monitoring of your patient if they are available. And if they are not available, you need to ensure that a restock is done by either ordering or having it from the main supply that is in the maternity unit. And that can be done through the intercom, whereby you call and you inform them of the supplies that you need, or one of you as a student can go to the maternity unit and get the supplies. So once all your supplies here are in check, you also need to have a check on the equipment that you're going to use for the day. So we're here. So in the equipment, you need to ensure that the resuscitator is in functional use and it's in ready to use mode. We have the concentrator here. You also need to ensure that it is in good working condition. The water bottles here are filled with fresh water and it's in a ready to use status. We have the bag mask that is used in resuscitation. You also need to ensure that it's in good working condition, clean and ready to use. We have the cylinder oxygen supply. So you need to have it on and tested to see if the supply can be readily available for use, so that you ensure that if it's not, it is set to a situation or to a case whereby it is in a ready to use status. We have the incubators that one is supposed to use. For example, if there's additional patients that are coming in, so you ensure that the incubators are also in good working condition, ready to use modes. We have the bins for waste segregation. In that morning shift is when you're supposed to check if they are full and need to be emptied, so that you take them to the respective area for segregation. We have the sharps box. You need to confirm if it is empty or it's full, and if it's full, it's supposed to be changed and taken to the respective area. And by so doing, checking all these equipment, and now you are in a position to be ready for the shift. And from there, then now you can go back to now having a general cleaning. This is actually done as you start your shift in the morning. So for high dusting, you need to go to the maternity unit whereby the main sluice room is, and you get the supply of the cleaning towels, the jig that you need to do the cleaning, and also the detergent that is used to do the cleaning. And as you come now, you do the high dusting, wiping the high surfaces, the areas with of the equipment that you're going to use, the incubators, the resuscitator, the station where the supplies are placed, the cabinets, all those we classify them as high dusting surfaces, and those are done with the towels that you have readily available at the maternity unit, and the supplies of the detergent and the jig that is available in the maternity unit. We have designated mops and cleaning buckets that are specifically for cleaning the NBU floors. That is mainly to avoid the cross-contamination from maybe mops that have been used from other areas into the newborn unit. So those mops that are used in cleaning the floors of the newborn unit are specifically designated for newborn unit, and once you're done with them and you clean after, you have to return them to the specific area where they are stored for ready to use in the next shift. So in summary, daily routine in the newborn unit is: step 1, before you enter the newborn unit, you have to do hand hygiene in a station that is right in front of the newborn unit. As you enter, you need to have the baby-friendly apron on. Then you go ahead and see your patients that you have been handed on the verbal report, confirm if it is a true copy of what you have or there is any escalation by doing your initial assessment. Once you do the initial assessment that involves the basic vital signs and general assessment of the patient, and they are good, then you go ahead and check on the supplies and confirm that you have all the supplies that you need for the shift. You check on the equipment and you ensure that they are in a good working condition, ready to use. Once you're done with that, then you embark on doing your general cleaning so that you can have a clean working surface area. And that involves using the specific cleaning buckets and mops that are designated for the newborn unit. And that is usually to prevent infection from the other wards to the newborn unit. Yeah, so once you're done with your cleaning, then you can now go ahead and now continue with your daily activities of patient care, and even doing all the other activities that will involve your participation during the shift. I hope this video gives you an overview of the routine of what happens in the newborn unit and how you're going to implement that to ensure patient care is in the utmost. Thank you.